Hi everyone! Welcome back to our channel. I am Dr. Seung Lee, a board-certified rheumatologist. 2025 is finally here. I wish you all a happy new year. This is our first video of the new year, so I would like to tell you a very hopeful advancement in autoimmune disease treatment. It is called CD19 targeted CAR T cell therapy. If you have never heard of it, don't worry. I'll tell you what it is and why it looks promising for autoimmune disease treatment. So, what exactly is CAR T cell therapy? CAR T, C-A-R-T, stands for chimeric antigen receptor T cells. In simple terms, it is a type of immunotherapy where a patient's own T cells, which are a type of immunocytes in our own immune system, so T cells are taken from their blood and genetically modified in a lab to attach the bad cells we want to eliminate. Do you remember that I said in an earlier video that our immune cells are like soldiers? So you can think that these soldier cells are taken out to the boot camp and get a special training to target exactly the bad cells that cause the disease. These cells are engineered to produce special structures that are glove-fitting to the target, called chimeric antigen receptors or CARs, which allows them to target and destroy the targeted cells. In fact, CAR T therapy is already used to treat certain type of cancers, where the CAR T cells are trained to kill the cancer cells. Just a few years ago, a group of German rheumatology researchers applied this idea to treat lupus patients whose disease were very severe and failed to respond to all the conventional lupus therapies. In this case, the target of CAR T cells was CD19, a marker found on B cells. B cells are the immune cells responsible for producing autoantibodies that mistakenly attack the body's own tissues in autoimmune diseases. B cells in lupus or other autoimmune diseases tend to be one of the driving force of inflammation because they keep producing antibodies to attack the patient's own tissues and cause inflammation and damage. So, CAR T cells that target CD19, a molecule on the B cell surface, end up wiping out all these bad B cells that have autoimmunity. And the result? It was outstanding. Let me explain the details. Initial study published in Nature Medicine included 5 patients with severe lupus that did not respond to traditional immunosuppressive treatments. Here's what happened. The patient's T cells were collected, modified, and reinfused after receiving a pre-treatment with chemotherapy agents to prepare their immune system. Remarkably, all 5 patients experienced complete remission of their lupus symptoms within 3 months. Lab tests showed a normalization of lupus disease markers, including the disappearance of autoantibodies. Even after their B cells returned several months later, these B cells did not show autoimmunity, and these patients were in a healthier, non-autoimmune state. This result gave researchers hope that CAR T therapy could be a long-term solution for autoimmune diseases. Now, there are a number of clinical trials that are testing CAR T for various autoimmune diseases. A recent study published on New England Journal of Medicine shows that it could also benefit patients with idiopathic inflammatory myositis and systemic sclerosis. This patient included 8 patients with severe lupus, 3 patients with idiopathic inflammatory myositis, and 4 patients with systemic sclerosis. The results were incredibly promising. All lupus patients achieved drug-free remission, just like in the first study. All myositis patients showed a significant clinical improvement according to the international criteria. All systemic sclerosis patients had a decrease in their disease activity scores, showing improvement in both skin and the organ involvement. Importantly, all 15 patients were able to stop their immunosuppressive medication completely. This is amazing, isn't it? Whenever we discuss immunotherapy though, safety is a key concern. Here is what the researchers observed. 10 patients experienced mild cytokine release syndrome, which causes transient inflammation in the beginning of the treatment. This is a common side effect of CAR T therapy. 1 patient had a slight more severe case, which required closer monitoring, and there was 1 case of mild neurotoxicity and 1 case of pneumonia that led to hospitalization. The patient with pneumonia recovered fully. Despite these events, the overall safety profile was reassuring, especially when we consider the severity of the autoimmune diseases these patients were facing. So, What does this all mean? It means that CD19 targeted CAR-T therapy could be a game changer for autoimmune diseases. By completely eliminating B cells that show autoimmunity, this approach may reset the immune system and replace all the bad B cells with entirely new healthy B cells, allowing the body to maintain remission without long-term immunosuppression. However, it's important to note that these findings are still very early. This was a relatively small case series, and larger clinical trials will be needed to confirm the long-term effectiveness and safety of this treatment, which are in progress. Still, the potential here is remarkable. For patients who have exhausted traditional treatment options, CAR-T therapy could offer a new path to hope and healing. Stay tuned for the new findings of the various ongoing clinical trials of CAR-T therapy for autoimmune diseases. Thank you so much for watching, and don't forget to like, subscribe, and hit the notification bell so that you don't miss any updates on the latest research and wellness tips. See you in the next video.